Dr. Stephanie, can I have a glass of grapefruit juice? I love it. I get this question more often than you might think, and I thought it was a great thing to address. So grapefruit juice can interact with some medications. Actually, it's quite small. So of over tens of thousands of prescription drugs in Canada, only about 85 of them have this specific interaction. How does it work? So in your body, your liver breaks down many different types of medications. And your liver does that by producing enzymes, so specific enzymes that break down specific medications. Grapefruit juice can affect one of these enzymes and really block it. When we block an enzyme, the drug that it's supposed to clear doesn't get cleared, and you'll see that drug go higher and higher in your system. Sometimes this can cause side effects. So if we're thinking about cholesterol medications, that can cause more muscle aches and pains. Or sometimes it can just cause that drug to go too high in your system and be too effective. So if you want to think about it like a drug for high blood pressure, well, if by taking grapefruit juice, that high blood pressure pill now is much stronger than it normally would be, your blood pressure is probably going to go too low. What drugs are culprits? And even though there are 85 of them, a lot of them are much less used. So I just wanted to give you a quick rundown of some of the more common ones that we see in practice. I think a lot of people have heard about the cholesterol pills, specifically statins. But in fact, there's only 3 statins that really have this interaction because it's very drug specific. So the 3 that have this interaction are atorvastatin or Lipitor, simvastatin or Zocor, and lovastatin or Pravachol, I think. So if you're taking any of these drugs, then no, you probably shouldn't have grapefruit juice. But if you are a lover of grapefruit juice, speak with your pharmacist. We could probably switch you to a different statin, still in the same class, still get the same effect, but now you can enjoy your grapefruit juice. Another key class of medications that can cause this, or that has this grapefruit drug interaction, cardiac drugs. So some of the more popular ones would be like nifedipine, which is Adalat, or amiodarone, which is used in cardiac conditions. If you have these drugs, probably stay away from grapefruit juice. But again, there are alternatives to these drugs as well. So we could switch you to something else if you enjoy grapefruit or grapefruit juice. Blood thinners are really big as well, and we're seeing more and more blood thinners in practice. So these would be like Plavix, Xarelto, also Eliquis or Apixaban. If these sound familiar to you, they will have a grapefruit drug interaction. And then there are some urinary tract drugs that you may be familiar with as well, like tamsulosin or solifenacin, which is Vesicare. So while there are 85 drugs, there are really a handful that we see every day in practice. If you are a lover of grapefruit juice and you're worried that you can't have any while you're on your medication, ask your pharmacist. We can look at your specific medications because it's not about classes. It's not that if you're on a cholesterol drug, you can't have grapefruit juice. No, it's if you're on a specific cholesterol drug, and that means that we could switch you to something else. So if you want to know, reach out to your pharmacist, ask them that specific question and ask them, hey, can you take a look at my drugs and see if I can have grapefruit juice? Excellent. Hope you found this helpful. If you did, give me a like, a share, drop me a comment. And this question actually came from a patient. So if you have a burning question, you can send me a message and let me know if there's a topic that you'd love to hear about. Thanks.